My name is Dr. Charles Young and I'm one of the Care Vision's directors. In this Insights video, Professor James Vickers, who's Director of the Wicking Dementia Research and Education Centre at the University of Tasmania, and Jeremy Hughes CBE will be discussing key research on risk factors for dementia. Some of the research they'll be discussing is published in the Lancet report on dementia, the Finnish geriatric intervention study, and the Ireland study linking neurodegenerative diseases and ageing. I hope you enjoy this video.
So the Lancet have published two commission reports over the last few years, the latest one just this year, talking about risk factors for dementia. Education, early education is certainly one in there. What are the others that stand out for you as the most important ones that people should be aware of?
Yes, so there are now I think 12 risk factors that the Lancet Commissions have sort of landed on as being important, and some of these might be more important at particular stages of life, and there are some new factors in there, I guess ones that we've always suspected, but I guess the balance of the weight of evidence has indicated that they're going to be important. So some of these are largely vascular factors, and vascular factors are probably important for vascular dementia as well as for Alzheimer's disease, potentially for other major causes as well. So these are things like low physical activity, hypertension, obesity seem to be important. In later lives, social isolation seems to be important, but diabetes as well seems to increase your risk. Smoking, depression in later life as well seems to be a risk factor. But then there were some interesting new ones like air pollution. Again, that's this balance of epidemiological studies across the world seems to show that greater exposure to air pollution seems to increase risk as well. So there's a number of these areas, but what we should emphasize, a lot of these are based on retrospective studies. So people looking back at various exposures and then trying to work out how much risk that might add to an individual or a population in terms of dementia. What we don't really know that if we, for example, people gave up smoking, whether that would lead to a dramatic decrease in the numbers of people who develop dementia. We've got some glimmers of evidence for that around in the area of hypertension, because now there's been lots of studies with large populations on now antihypertensive drugs, and that does seem to have a positive effect. For many of those other factors, we don't really necessarily know that if somebody changed their behaviour that related to that factor, whether that would then lead to decreased risk of dementia.
And of course, the Lancet report is really a collation of all the evidence from recent studies put together by a panel who consider that evidence. You seem to be in the forefront of increasing the level of evidence that there is. And the Ireland programme that you're now starting does seem to be one of the biggest studies and the most comprehensive studies that's ever been undertaken, precisely to find out a little bit more about the way in which people live and can modify their risk of dementia. Can you tell me a little bit about the Ireland programme that you're now developing in Tasmania?
Yes, so this is a relatively new program of research for us. But one of the things that's come out of all of these new epidemiological studies is the idea that maybe you could have a public health approach to reducing risk of dementia. So if part of the problem here is that people may not even know what many of these risk factors are. So can we get that out into a population, get them thinking about their individual risk, and then trying to encourage and support them to change the behaviours that relate to that risk. So we're looking to try and sign up about 10% of the Tasmanian population over the age of 50 for this Ireland study linking ageing and neurodegenerative disease, Ireland. Really is a bit of a pilot, because if we can make this work in Tasmania, maybe this is something that we can then extend out nationally and internationally. So we're looking for 20,000 or so Tasmanians to be involved in this project. We're around about 13,000 people. Tasmanians tend to be quite good volunteers for health and medical research, which is an advantage from working from this island. And what we're doing is we're providing them with a number of tools, like a dementia risk profile tool, which allows them to go through a survey, and that then highlights areas of risk and gives them feedback on what they might do to reduce that risk, or understand and then reduce that risk. We're also providing a number of, I guess, other sort of community-based opportunities, I suppose, to get involved in programs to reduce risk. We're utilising our free online course, the MOOC that we have around dementia prevention. That's also a tool that people can engage with, so they can understand their risk a little bit better. And I guess once you know about some of these risk factors, you can't unknow them. And maybe over time that helps to encourage them to change their behaviour. But basically, it's sort of basically a behaviour change and feedback program to see if people can actually tackle some of those risk factors in their own life.
And it does seem to tie in very closely to the work that Care Vision's Healthy Aging have been doing both in China and the UK, looking at how do you engage people in a frequent, regular program of healthy living activity that changes their behaviour and modifies their risk of a number of diseases, not just dementia, but aging diseases in general. It sounds that's a very parallel piece of work.
Yes, that's right. So many of these risk factors are important risk factors for cardiovascular disease and many cancers as well too. So that if you can get some of those under control or reduce them individually and reduce their impact, you may well be doing yourself a favour, not just for dementia, but for a whole range of other things that might pop up as your years advance.
And how long will that study go on for, the Island programme?
It'll get designed to run for 10 years, and our main outcome over the first few years is to see whether anybody changes their behaviour. Because if we don't get the behavioural change that is linked to those risk factors, then again, as a public health intervention, it's probably not going to play out so well over time. And then over time, we'll be comparing the relative risk of this group of people in our Island program with the risk of dementia in the wider Tasmanian population.
The other study that I've come across that sounds similar in some respects is the FINGER study run out of Finland. Can you say a little bit about that and how that compares to the work you're doing?
Yeah, so this is a good program that's become quite popular around the world. There's now a worldwide FINGERS program where the study that arose initially with Finnish population, which was looking at what they call a multi-domain intervention. So this is where the participants are encouraged to engage in a number of programs that again targeted at these risk factors, and they certainly found benefits over 2 years in particular cognitive domains. But I suppose the question still remains that if you get that cognitive benefit, does that then play out in terms of risk of dementia over the longer term? And that's something I think we're all waiting to see might occur. Their approach also is a little bit different to ours. The multi-domain interventions tend to be very well structured, and the participant is essentially guided in what they do. Whereas with Island, what we're trying to do is encourage what we call kind of self-efficacy in managing their dementia risk. So a lot of that is really about that individual understanding their own risk and then providing them with the tools and the knowledge to do something about that risk. And then it's kind of up to them as to whether they do anything about it. But that's more of a sort of a public health approach, yes, health promotion kind of approach than here's a structured program. And if you do this, that and the other thing, then that may well reduce your risk.
And in the Island study that you're developing in Tasmania, will you be guiding people in the frequency which they should take actions, or is it going to be up to them and you're going to monitor depending on what they choose to do?
That's right, yeah. So we'll be monitoring them on a yearly basis, where they'll undertake surveys and online cognitive tests. We're also interested in looking at biomarkers of neurodegeneration. So we'll be taking blood samples and looking genetics and all of that as well. But it's essentially it's educating people to consider their risk. And again, we would hope that then is sort of ends up with a virtuous cycle where they understand and think about their risk, and then over time they're actually doing things to reduce that risk.
More information about the work of the Wicking Dementia Research and Education Centre, the publications and projects discussed in this video are available on screen and in the description links below. Please do subscribe to our award-winning YouTube channel for more Healthy Aging Insights videos from CareVision's Healthy Aging.